Are you hypermobile and have back pain despite your attempts to exercise? In this video, we're going to talk about the 3 most common reasons that I see as a physical therapist that people continue to have back pain with Ehlers-Danlos Syndrome or Hypermobile Spectrum Disorder. So the first point is making sure that we have a neutral spine. And what we mean by a neutral spine is the spine has natural curvatures. In the low back, there should be a slight inward curve. In the mid back, called your thoracic spine, it should reverse, called a kyphosis. And then in the upper part of your spine, your neck, there should be, again, another little bit of an inward curve called a lordosis. So when we're exercising, if we're doing exercises that don't have the natural curvature of the spine, like we're aligned incorrectly, then we begin to activate the wrong muscles and we can develop patterns that are contrary to our goal of increasing our strength and our stability, especially in the low back. So when we're talking about this with someone and we're teaching them a neutral spine, one of the things we want to look at is just how they begin to move. So Naya, if you could put your hands just by your side there, and if you're looking at yourself, you can do this by carefully lifting your head either with a hand or having somebody else look, or if you have a mirror next to you, that's even better. And what we're looking for is the positioning of the pelvis, so in relation to your rib cage. So if we ask Naya, if I said, Naya, tilt your pubic bones way down, so really arch your back as far as you can, good. So now you see how her rib cage flares out, and then she's got a lot of tilt in her pelvis, her pubic bones are pointing down. And that's not correct, and a lot of times we'll see people exercising, go ahead and let that relax. And when people continue to exercise in that way, then they're creating strain in their back because they're overusing several of their back muscles. Now there's also the opposite extreme, so now go ahead and completely flatten your back, tilt it the complete opposite way. Exactly. So this is also not a neutral spine because now we flattened that curvature in the low back that we were talking about in the first point. So now just let it rest for a moment and come to a relaxed position. Go ahead and place your hands around your hips there, so kind of like the angry pose, yeah. And begin to take it all the way to the extreme again, yep. And then all the way to the other extreme. And we're gonna find about halfway in between that. Exactly. So what we're looking for is that your pubic bones should be relatively flat. Now in her case, she likes to tilt a little bit to the left, so we wanna have her ground down onto her right hip as well. So you should feel both sides of your pelvis because when we're doing exercise with hypermobility in these early stages, it's really important to be exercising lying down, especially if you have POTS, MCAS, or other conditions that go along with your hypermobility. So we really want to find that neutral spine starting at the pelvis and also the rib cage. Again, if we are flaring those ribs out or we're completely flattening that spine, we're going to activate a totally different group of muscles. So this is a fundamental point, making sure that we have the neutral spine. In another video, we'll look at how you translate this into other positions, like sitting or standing. If you're interested in this, be sure to leave a comment below. But for now, for the purposes of this video, we found the neutral pelvis so we can begin to exercise. So that's point number 1. Point number 2 is trying too hard. So if you've been in pain for a long time, a lot of the times what can happen is we try really aggressive, right? So if I gave Naya, for instance, a ball and I put it right between her knees here, so go ahead and open the knees a little bit, perfect. There's a big difference. This is just an example exercise, but you can apply this to all your exercises. There's a big difference between you taking that ball and squeezing it as hard as you can with all your might and someone saying like, okay, sneak up on it like a whisper. Now I want you to gradually squeeze the ball. Exactly. Movement is that way. There are shades of gray in movement. There's in between, it's not black and white. And that's because we have to do different things in our life. It's very different if we have to, lift something to save a child's life. We have to lift a heavy object or something like that, save someone. We're gonna have all this adrenaline flowing and we're gonna produce a lot of force. But most of this, if we try too hard, then we're gonna activate a whole bunch of other muscles that we don't intend to activate. So when we do these kind of exercises, whether it's a ball squeeze, whether it's clamshells, whether it's a bridge, whatever your physical therapist has prescribed, we want to make sure that we're doing it with as little effort as possible. And that may be contrary to some viewers and you know, like my personality type, I want to go all in, right? But a lot of times when we go all in, we end up activating a lot of muscles which cause spasms. Our last point is going too far. So I'm going to take the ball here. So with hypermobility, here's an example. If we were doing marches, for instance, so Naya, go ahead and bring your knee all the way up to your chest there. Yep, good. And then bring it back down. So just because she can doesn't mean she should. And that's true of anyone with hypermobility, because when we move through the extremes of the range of motion, that's where the joints and the muscles are the weakest. So moving through 50 to 75% of your range of motion is where the joints, the tissues, the connective tissues, and the muscle tendons are going to be the strongest. So if we were doing that, if let's just say that were an exercise that was prescribed by your physical therapist, and I might say to her, now let's cut that in half, all right? That was your 100% of your range of motion. You went through now let's cut that in half. So come up till you feel my hand. Perfect. So about halfway. She's gonna be a lot stronger in that position than if she's going all the way to the extremes. That's usually where subluxations, where your joint comes a little out of place, or dislocations occur. So these are principles that we want to think about. These aren't specific exercises per se, but you can apply principles to all exercise, and also in the way that you go about your day and move through life. Now these were just 3 concepts, 3 of the most common reasons we see. You want to be sure too that you're having a thorough medical exam and ruling out some of the other causes of back pain. If you've done all these things, you're like, Chris, I've done these, I get it, then you want to make sure that there's not something else going on like tethered cord syndrome, arachnoiditis, anterior listhesis, where one vertebrae slips in front of the others. So if you've done all these things and you've really worked at it with a physical therapist, then it may be time to push for imaging. So those are the top 3 most common reasons that we see continued low back pain. We highly encourage people, you know, if you haven't had a great experience with a physical therapist, we're really sorry. That is all too common. We hear that story all the time, but don't give up. Keep looking for people that are truly invested in this population, and be sure to subscribe to this channel if this is the kind of content. If you like this, if you made it this far, then and you found value out of this, be sure to subscribe to our channel and give the video a like, and let us know what else we can do and what kind of things that you're interested in seeing.